Systems applicant briefing. My name is Carolyn Johnson. I'm the program manager for GACD, so I run everything funding related. And I'm guessing that you're all here because you're experts in implementation science and chronic non-communicable diseases, and you're looking for ways to use all that expertise and find funding for your next research project. So whilst we're waiting for everyone to join, please do feel free to use the chat box and introduce yourselves. Say who you are, where you're from, what you're interested in. It could be a really good opportunity to find some collaborators if you're looking for them. So today I'm just going to chat through some of the specifics of our latest funding call, which is focused on implementation research, targeting strategies to strengthen health systems to tackle the growing burden of NCDs. So I'll just quickly run through some housekeeping and the plan for the session. Please do keep yourself muted throughout the session and do pop any questions in the chat, and we'll try and answer as many as possible at the end of the session. And then anything we can't answer straight away, we'll add to the FAQ document that will then pop up on the webpage afterwards. And just so you're all aware, we are recording this session, and we will put a recording up, and then we'll also pop a copy of the slides up on the webpage as well. So for this briefing, I'm just going to run through a bit of background about GACD, and then I'll give an overview of the call and how it will run. I'll take you through how to apply and guide you to some resources before we move into the Q&A session. So GACD is an alliance of 11 international funders. We act as a hub bringing funding agencies together to tackle the growing burden of NCDs using implementation research. As you can see, most of our funders are state agencies from across the globe with high, middle and low income countries represented. And if you're interested, you can actually find out a bit more about this on our website. I just mentioned that the funders come together to reduce the burden of chronic non-communicable diseases in low and middle income countries and in underserved populations in high income countries. So the GACD model is quite different to other funding organisations. We do much more than just fund research. We also have an amazing research network model, which we use to facilitate collaborations and partnerships and support networking. We also run lots of training events to support capacity building and implementation science. Just to give you a bit of an idea about what GACD has done in the past, the Alliance was set up in 2009, and in 2011 they ran their first funding call, focused on implementation research around strategies to prevent and/or manage hypertension. This was followed up with a series of disease-focused calls until 2021, when we launched our life course call, which encouraged a much more holistic approach, addressing NCD risk factors across key life stages. We then ran our Healthy Cities call. Last year, we had our Management of Multiple Long-Term Conditions call, which are actually in the process of awarding. And this latest call is then focused on implementation research, targeting strategies to strengthen health systems to tackle NCDs. Just in case it is of interest, you can find out more about our funded projects on our website, and we'll pop the link in the chat shortly. So how does this all come together? All project teams funded through GACD, whether this is through our joint process, the EC Horizon call, or the US National Institute of Health call, are all invited to join our research network as a part of a research program. So teams awarded through our Cities call are invited to join as part of the Healthy Cities research program, for example. Then the network connects principal investigators, research teams, collaborators, and even funding agency staff, creating a really powerful space for knowledge sharing and collaboration. We run training and networking events, both virtual and in person, throughout the year, and this is really an amazing opportunity to work with a wider group studying similar topics and sharing learning. As part of our network, everyone has the chance to join our workshops and our annual scientific meetings. And network members can also apply to join our implementation science schools and masterclasses. So that's it for the background information about GACD. Let's move on to some of the finer details of the call, focusing in on our funding model, who's taking part in this call, and how to find out information about the different versions of the call, and a bit about the remit. So I'll just quickly describe our funding model. The funders that are a part of our alliance come together to develop a common call text with the help of some experts in the field. We then agree all of the finer details, including which funders will be taking part. And this is really key because funders in our alliance can not only choose whether or not to take part in a particular funding call, they can also choose if they want to run it using their own independent process or take part in a joint process run centrally through GACD. So in this briefing, I will mostly be concentrating on our joint application process, but it is first important to mention the parallel calls. So we usually run our funding calls through 3 parallel routes: the joint process, which I just mentioned, the EU Horizon call, and the US National Institutes of Health call. For the systems call, the EU Horizon version is currently up on the Funding and Tenders portal, and they'll be holding an info day on the Cluster 1 Health, which this is part of, tomorrow, so the 22nd of May. So if you have questions about the Horizon process, this is absolutely the place to go. And we'll pop the links to the register for that, or not register, it's a live stream, to look at that in the chat as well. The US National Institutes of Health intend to participate in this call, but as you can imagine, things are quite uncertain with the NIH at the moment, so it's worth actually just keeping an eye on their site for any updates. Again, we'll put the link in the chat. Finally, there are 5 funders participating in the joint call. These are the Australian NHMRC, the South African SAMRC, Indian ICMR, Thai HSRI, and then FAPESHB from Sao Paulo in Brazil. Focusing in on the funders in the joint process, some of these funders require applications to be for joint funding. So that is an application that will go to 2 of the funders in the call. SAMRC, the South African funder, specifically require applicants to request joint funding with NH and MRC. So that means that any applications coming from involving South African researchers that want to apply to SAMRC must have an Australian lead PI on board. HSRI from Thailand and ICMR also require applications to request joint funding, but they don't specify a specific funder. So you could even apply for joint funding between HSRI and ICMR if you wanted to do work in Thailand and India, for example. NHMRC and FAPESHB encourage co-funding applications, but they will also accept applications straight to them that are only requesting funding from them as an agency. Submitting an application for joint funding is simple. So you submit your single application through the joint portal, and this will go to all of the relevant funders. But you must ensure that the application meets the eligibility requirements of all of the funders that you're applying to. So key information. Our current call is focused on implementation research for interventions to strengthen health systems to tackle NCDs. But as always with GACD, we're looking for research to be carried out in low or middle income countries or in underserved populations experiencing health disparities in high income countries. And this includes some Indigenous populations. Also, it's really important to remember that GACD focus on implementation research proposals. So we're really looking for projects studying implementation of evidence-based policies or interventions. Key for all GACD projects is a good consortium. You need to show that teams are demonstrating that they have equity, the right expertise on board, and have achieved a real geographical, community, and career stage balance. We know a little bit about who can apply, and we know some of the key issues to think about. But what are we hoping for as outcomes from this funding call? We're hoping that proposals funded through this call can expand availability of care for patients with NCDs, or promote equitable health outcomes. We're looking for things that could promote the early prevention, risk reduction on timely diagnosis of NCDs. We're looking to decrease the fragmentation of care. We always want our projects to adopt a patient-centered approach and focus in on reducing health inequities. We also want our projects to consider implementation, research, capacity building, and think about how to improve quality of life across the life course and extend healthy life expectancy. And finally, we also expect our projects to try and provide evidence and recommendations to national programs and policies. So now I'm just going to quickly look at the joint process and go through the timeline. So this joint process, as I mentioned, is the version of the call that's coordinated by GACD. So the joint call is open now, and the deadline for stage 1 applications is rapidly coming up on the 16th of June. Please do make sure you check the time. Our calls close at 5 p.m. UK time, so that's British summer time at the moment, which is 6 p.m. in Europe. Please don't wait till the last minute to submit. It's really difficult if we find applicants emailing us saying, but I thought it was tomorrow, and the portal is closed. We'll be running peer review then for our applications from June through early August, and we'll send out feedback and invite people who have submitted a competitive application to submit a second stage proposal in early September. The deadline for second stage proposals will be the 22nd of October, and we'll be running our peer review meeting in December. It often takes a bit of time for agencies to work out what they can and cannot fund, so we anticipate outcomes will be March 2026 at the earliest. So now I'm going to delve a little bit further in how to apply, including where to look for information, a bit about who can apply, and then some information about our new application portal. So where can you find information to help support you with your application? And please don't worry, we will put these slides and links into the links into the chat and the slides up online, so you don't have to try and desperately like screenshot or type things in. So first of all, you can take a look at our GACD webpage. This has information about all 3 planned versions of the call. There's a specific page with all the information about the joint call process, and then a link to the applications portal for the joint call. For the parallel calls, you can find the links on our website, but you should look at the Fogarty webpage for information about the NIH planned calls. And then, as mentioned, head to the Funding and Tenders portal for information about the Horizon call. And of course, please do watch the Horizon Info Day webinar tomorrow. Also, we have an amazing comms manager, so it's really worth following us on socials, as a lot of this information will also be available there. So I thought it might then be helpful to just briefly go over the application format for the joint process. GACD run a 2-stage application process for our joint call. So we'll peer review all stage 1 applications, provide feedback to all applicants, and invite those applications that show potential to submit a stage 2 proposal. This should mean that applicants don't need to wait 12 months to find out they've not been awarded, but also should allow those applicants who've been invited to stage 2 to make changes to their proposals in response to peer review feedback before the final peer review panel meeting. Applicants will also receive feedback and outcomes following the panel meeting. It's really important to remember that these stage 1 proposals are quite short, and it's much harder for applications to show every detail. So really do remember and focus in on how to consider how best to get your message across in a really small space. So who can apply and what are we looking for from our project teams? The principal applicants or investigators must be researchers, and they must meet the eligibility criteria of the funding agency to which they will apply. Typically, most of the agencies taking part in the joint call will require a PI to be from a specific geographical location. For example, the NHMRC requires the lead investigator to be a permanent resident in Australia. If you're not sure, please do check with the funder that you're applying to, and they'll be able to tell you if you're eligible to apply. And the information and contacts for those funders are available on the webpage for the call. The application isn't just about the principal investigator, though. It's critical that the right team and the right expertise are involved. And this means including expertise in implementation research, but also remembering to keep the team interdisciplinary. When we think about the structure of the team, we want to ensure that there's a balance of genders, ethnicities, social backgrounds, geography, and career stages. It is really important to ensure that there's adequate representation from the country where the research will take place, and that they're in an appropriate place in the team. Finally, projects should also reflect clear early engagement with stakeholders, including community members or patients, health providers, NGO implementation leaders, local ministry officials, and national policymakers. For this call, the proposal format has changed again, just a little bit this time. So please do make sure you take a good look at the webpage, check out all of the guidance, and download all of the templates. But these are just some of the things to think about when you write your proposal. We want reading applications to be easy, so really think hard about the reviewer when you're writing. Make it clear and easy to follow, and stay within the word and page limits. Nobody wants to have an application rejected just because it hasn't followed the guidance. Please do make sure that any ethical or security issues are clearly addressed and, if possible, mitigated for. Think about outcomes. Lots of projects won't have health outcomes in 3 to 5 years, so the outcomes need to match the timescale. And don't forget to include implementation outcomes too. So now just a bit about how to apply for the joint process. You'll notice that for this year, we've switched to a new application portal, which is run on Airtable. The thing to be aware about with this is that you cannot save your application as you go. So first of all, please leave plenty of time to input all of the information and make sure that you have all of your uploads ready when you're submitting. PIs can only submit one application to the call across all participating GACD funding agencies in the joint call. But you can be a PI on one application and a co-I on multiple others, and you can be a co-I on as many applications as you want. You may be required to also submit the application through the funding agency's own system. For PESH, we are requesting all applications to them also go into their SAGE system. When I checked this morning, this wasn't quite live yet, but we will put those updated links into our website as soon as it is. Please also remember that the application must be submitted in English. There is some guidance around translation on our website, but I would always recommend getting a native speaker to read through the proposal if you're worried. So this is just a bit about what the portal looks like. If you see a little red star next to something, that means it won't let you actually submit the application unless you've entered your details in there. And any problems with this, just send me an email. As you can see, it's really relatively simple. And just note that you can pick your primary funding agency, but you can also add as many additional funding agencies as you're eligible to apply to. And then there's plenty of space for adding in your project details, your abstract, and then you'll find that you can upload all of the relevant files, including your proposal form. So you'll also find that you have to give a little brief description of any ethical issues and also note whether you have ethical approval or not. And then you'll find there's a space for final checks, which includes a checklist to make sure that you know that you've uploaded all of the right details and all the required additional optional annexes. Things like the MIRA form, which we require for digital interventions, and then the Indigenous Research Excellence criteria, which is required for applications to NH&MRC involving Indigenous communities. So please forgive me, because I'm now going to do the little bit about the Indigenous Research Excellence form, and I am definitely not as good at doing that as my lovely colleagues from Australia who did it this morning. So for GACD projects based in Australia, working with Indigenous communities, NH&MRC is committed to improving the health outcomes of Aboriginal and Torres Strait Islander peoples, and they encourage applications that address Aboriginal and Torres Strait Islander health. Applicants proposing to undertake research which specifically relates to the health of Aboriginal and Torres Strait Islander peoples, or which includes distinct Aboriginal and Torres Strait Islander populations, biological samples or data, must refer to the resources listed in formulating the research project. So NH&MRC has several really useful resources in order to assist applicants whose research does involve Aboriginal and Torres Strait Islander peoples. And these are provided to NH&MRC GACD applicants in the NH&MRC grant guidelines, and they're also available in the agency-specific information on our funding call website. So the Indigenous Research Excellence criteria cover community engagement, the benefit to the community, the sustainability and transferability of the intervention, and building capability within the community. So I'll just quickly run through the peer review of applications which involve Aboriginal and Torres Strait Islander health research. So relevant applications complete the IREC questionnaire, which is available on our webpage. The IREC responses are provided to GACD peer reviewers for consideration against the GACD assessment criteria. Relevant applications respond to the IREC criteria within the NH&MRC Sapphire application, which happens at stage 2. NH&MRC coordinates an evaluation of IREC responses at both stage 1 and 2 by a reviewer with specific expertise in Indigenous health research. The reviewer considers the benefits of the proposed research and whether the research will be undertaken in a culturally appropriate manner. The evaluation of IREC responses will be provided to the GACD International Peer Review Panel. The evaluation doesn't give a numerical score, but it will be taken into account by the panel in the overall assessment of the application against the GACD assessment criteria. So I hope that made sense. And I just thought I'd finish this little section by reminding you of a kind of checklist for things that we all want to be thinking about when preparing an application. So first off is plan everything. Download all the templates from the GACD website. Please take a look at the portal and familiarise yourself with it. Organise your letter of support. Please double check your study design and sample sizes, and then think like a reviewer. Look through again and think, what can you do to improve your proposal? Think about what could you add, remove, or modify. So now I'm just going to finish up my bit of excessive talking by signposting some useful links developed by our amazing staff team and fantastic researchers. So first up, we have the GACD application guidance. And this is specifically developed with a group of some of our funders and researchers. And it includes our general proposal guidance, the evaluation criteria, some top tips for writing applications, and some external links to the EC Horizon and NIH. These can all be found on our website, and we can pop the link to that in our chat. Next up, we have the Implementation Science eHub, which is a fantastic resource to help you learn more about implementation science. It's fully open access and self-paced, and this is a great place to start your implementation science journey. It also has some really useful real-life examples of implementation science for tackling NCDs and an extra resource hub with other external tools and guidance. The eHub also has some brilliant collections of resources, and I can highly recommend taking a look at the Stakeholder Engagement Collection, which can introduce you to stakeholder engagement, but also provide some links to lectures, some links to resources and toolkits, and case studies, which are really, really helpful. So now I'm going to move on to the questions section. We've probably all been waiting desperately for this point. So what I will try and do is try and run through the questions in the chat in order. If I don't get around to your question, please don't worry. We will put together an updated FAQ document and add that to the webpage. And if you feel like your question's really not been answered, please do email me on the funding@GACD email address. So I'm just going to stop sharing now and then hopefully have a poke through the chat. Hold on a minute whilst I move things around, sorry. Oh my goodness, I love these lists of questions that are enormous. Sorry, you have to give me 2 seconds whilst I scroll right up to the top. So, and I'd just like to say we're also lucky enough to be joined by some nice colleagues from FPESHB as well. So if we do have some FPESHB specific questions, we will be dragging them in to answer. Okay. I'm just going to dive down. It's lovely to see so many people, so many of you with us as well. Really, really nice.
Marilyn, would you like me to read out some of the questions that I found?
That would be really helpful because I'm still scrolling.
Yeah, no worries. So there's one from Sarah Rashid. Are the expected impacts the same under the Horizon call? The cluster one isn't clear to me.
Yes, they are. So we do have, the call text is coordinated between the funders. So it's exactly the same expected impacts across the two. Primary funding agency, so I've got to Asma. So she's asked about what does the primary funding agency means. When you're applying to the joint call, you'll be applying to a funding agency, and then potentially, if you're looking for joint funding, you'll be applying to another or several more funding agencies. So if you're applying to NH and MRC and the SAMRC, then NH and MRC, the Australian funder, would be your primary funding agency, and SAMRC would be the secondary one. I hope that makes sense. UK funders are not part of this call. No, there are no UK funders on board. So Caroline's asked if there is a way to access an overview of researchers interested in applying who are still searching for collaborators. We do have this thing we call our Find a Collaborator tool, and you can post to that if you're interested. And then we will, basically, it's like a listing service. You just fill in your details, how to contact you, and a bit about what you're interested in, and it goes up on our website. And you can have a look through there as well. We do accept, so I think oral health, if you're talking about oral health as a prevention of NCDs, because at the moment I think we see oral health is more of a risk for NCDs than actually an NCD.
Sorry, Carolyn, it just got muted again, like happened to me the other day.
Thank you. Sorry. Did I do the oral health one then? I'm going to ask you.
Most of it,
Cool.
maybe a quick repeat.
Yeah, just say oral health would probably fall more under prevention. So you wouldn't want to be focusing on oral health as an NCD, because at the moment it definitely looks like it's more associated with prevention. There is, as I think everyone's replied to you already, there is a page that publicly displays all of our previously funded projects. We will be putting a recording up on the website. UK organisations are eligible to apply, but only obviously if they're going in with a lead organisation from one of the other funders, and that only funder that would do that would be Australia. So UK partners can go in only if they've got an Australian lead. But the other thing is that UK funders can obviously apply through the EU Horizon call. If Indonesia is now an upper middle income country, then it's still eligible to apply, because we technically call it low and middle income countries. So it's only high income countries that you wouldn't be able to apply for a project that was working with your kind of basic population in high income countries. So you wouldn't be able to go in and say, we want to look at everybody with type 2 diabetes in the UK. But if you're looking at an underserved population, potentially an Aboriginal or Torres Strait Islander population in Australia, that is absolutely eligible. I hope that makes sense. The last date for the stage 1 applications for the joint process is the 16th of June. Could a team from South Africa be part of the EU call? Yes. But what you can't do is ask for joint funding through the Horizon call. So remember, like I said, all of the 3 different calls are separate, and you can't request co-funding from Horizon and a funder in the joint call, or Horizon and NIH. I hope that makes sense. So the maximum budget is basically defined by you. Each funder puts a committed budget into the call, and then they also put a number of projects that they're anticipating funding. For example, if a funder has said they're going to put $1.5 million into the funding call, and they're expecting to fund 3 applications, then you can imagine they're expecting applications to come in around the $500,000 mark. So, what you do have to do is check on the webpage and check the agency-specific information for the funder that you're considering applying to, and the details will be in there. So you'll be able to work out what's a sensible budget for your project. So deadlines and country eligibility, I think we've already covered the deadlines. So everyone has to get their stage 1 application in for the 16th of June. For the joint call. Country eligibility, you can apply from South Africa as long as you have an Australian lead partner. You can apply from India as long as you have requested co-funding from one of the other agencies in the call. And this could be Australia, it could be Thailand, it could be Brazil. You can apply from Thailand, again, if you've requested co-funding from another agency in the call, and that could be India, Australia, or Brazil. And you can apply from Brazil, or not Brazil itself, actually, sorry, Sao Paulo State to FAPESP, and you can also apply straight to Australia. But applications to the NH&MRC can also come from low and middle income countries as defined by the World Bank. So you have to have a lead Australian-based principal investigator, and then the rest of the team ideally would be a mix of Australians and people based in the country where the research is taking place. So you could apply to NH&MRC with your lead from Australia and a team working in Uganda, for example. And if you want to know if you want to look, we actually do have the link to the World Bank definitions of country income on our webpage as well. Right. Do you need to formulate proposals on oral health as mentioning the link between oral health and NCDs? Absolutely, because otherwise it might not be in remit. If you plan to Horizon, you do not need to apply to GACD through the 16th of June. You just need to apply straight through Horizon through the Funding and Tenders portal. And their deadline is obviously in September, so you've got plenty of time to do that. To apply from Pakistan, I would suggest that you would need to have a lead researcher in Australia in order to do that. Tanzania would be the same thing. You could apply from Tanzania, but again, you would need a lead researcher in Australia. So you must apply for a joint application. If you're applying to ICMR, you must apply with another funding agency on board, and that could be the NH&MRC, that could be Sao Paulo FAPESB, that could be Thailand HSRI, and the deadline is the one for the joint call. It's all one application. I think I've already defined LMICs. I think for Ukraine, Horizon is probably the most sensible option. I think we had this question this morning as well, and I do believe that Horizon is probably the best place to go. The lead couldn't come from Ghana. Again, you would need a lead based in Australia in order to make that application. So if your research team is from a low-income country, such as Colombia, you would need to submit a project, and you'd need to partner with an institution from the funding country or the state of funding. So that would absolutely be it. And again, I suspect for Colombia, you would need to be applying with an Australian team on board. Examples of implementation outcomes. I actually almost feel like I should ask Izzy to do this one because it's definitely more her area of expertise than mine.
Well, again, I would push people to go to the implementation sites e-hub that we have and take a look at there's a huge number of resources there, but things we might include is reach and penetration and maintenance. So there's a whole host in there that you'd want to choose between and to choose the right ones for your project.
Thank you, Izzy. That is perfect. Malawi, again, would be eligible if you had an Australian lead on the team. Bangladeshi researchers would not be able to act as the lead researcher on the projects. So if you had a project with an Australian lead and a Bangladeshi team, we would be expecting to see the Australian lead and then obviously the Bangladeshi researchers coming up next in the list. If you apply to NH&MRC with an Australian lead PI and an LMIC partner, you can also include researchers in other high-income countries as collaborators. Do this sensibly and think about how much you need, but that is absolutely okay. So again, yeah, if you aim to apply through Horizon, you do not need to apply through the GACD portal. So the letter of support is really interesting. For the first stage, the letters of support that are actually absolutely mandatory are the letters of support from the research organisation where the lead PI is based, and then the research organisations where any of the other co-investigators or teams of co-investigators, again, are based. That letter of support needs to state that the research organisation is aware of your application, that they can provide you with the resource kind of infrastructure for you to carry out the project, and that they're supportive of the project. And really that's the kind of bare minimum that we're expecting to see. This is the way we understand that your research and organisation is happy for you to actually put this application for funding in. It is always acceptable to have letters of support from other partners, and particularly other stakeholders. It's always useful, and it's really good. We're really keen. We often get letters of support from ministers of health or from local NGOs, and that's also really good to see and really supportive of your application. The Horizon budget, if I'm correct, is 20 million euros, and they expect to fund 5 projects, so 3 to 4 million euros per project. It's the same as it's been for the past couple of years. The website, that would be that for the multiple long-term conditions call that it closed in 2024. So the health systems call is forthcoming. It's actually up. Sorry. Yeah. Okay. I can see that now. There is a direct page to get collaborators from different countries. As we just mentioned, that's the Find a Collaborator tool. I've just done the Horizon budget. So a co-investigator can be from Nigeria, but there is no way the principal investigator in this call could be from Nigeria. I would highly recommend that the best thing you can do at the moment is keep an eye on the US National Institutes for Health webpage. Again, because previously, principal investigators from low and middle income countries have been eligible to apply through NIH. However, I would temper that by saying, obviously, there have been lots of changes in terms and conditions recently for NIH grants. So you should be really careful and make sure you read those very closely. Should there be an implementation research focus in the country where the funding agency is based? Well, if you think that HSRI, so let's take an example. HSRI Thailand wants to fund research in Thailand. So they're expecting to see implementation research happening in Thailand. But if you were working in Australia, they would still expect to see a degree of the research being carried out in Australia, but not necessarily the implementation of the intervention. So you could be implementing, and it could be studying an intervention that was being implemented in Malawi, for example, but some of the team in Australia would be carrying out some of the research. We'd be expecting to see that team traveling out to Malawi, working closely, collaborating closely. I hope that makes sense. Yes, so organisations from Pakistan could not be the principal investigator, and you would need a PI from Australia or other countries to join. They absolutely cannot act as the principal PI, and that is for the joint call. For the Horizon call, again, you would need to find a group that are associated from a country associated with the Horizon programme, and you would need them to be partnering with you. So Uganda is eligible, but only, again, if you're going for the joint call, Uganda would be eligible going through with an Australian partner. And for the Horizon call, you would need to have Horizon associated, or people from Horizon associated countries on board as well. And that's the same goes for Egypt and Senegal. For Horizon, the UK applicant doesn't necessarily, as far as I know, they don't necessarily need other EU partners, because the UK is associated with Horizon, so they're eligible to apply through it. So you don't. Marsha has very, very kindly said that FAPESHBI will be hosting a webinar to discuss the specificities of any applications going to FAPESHBI, and check the FAPESHBI website, because they will announce the date on there. Thanks, Marsha. I will also keep an eye on the FAPESHBI website and make sure that we can try and get that up online. So for the Horizon call Zimbabwe, if you're applying from Zimbabwe for the EU Horizon call, you would need to have, as I mentioned, a partner from a country that is associated to Horizon. So this could be one of the EU 27 countries, but there are some other countries that are also associated with Horizon, including the UK. The Horizon application is completely different. And I highly recommend that you go and check the Funding and Tenders website and have a look, because actually they're incredibly lengthy and complicated, and it's single stage. I do believe they require some form of letters of support, but I am not completely sure. So for that, what I recommend you do is log into the website, watch the Cluster One Health tomorrow, ask your questions. There's also an opportunity on that website to post your questions before the webinar, so you can take that opportunity as well. South Africa, again, wouldn't need an Australian PI for EU Horizon. You would need a PI, potentially could be a UK PI or a PI from one of the Horizon associated countries. What's the specific role of non-researchers? It can be anything, but most commonly, the non-researchers tend to be implementers. We often see things like youth group leaders or local community leaders, and they're really the people who are going to help you integrate, especially if you're working in a specific community. They're the people on the ground who are helping you to make sure that people are actually engaged with and involved with what you're doing. The Horizon call it's currently listed up on the Funding and Tenders thing as forthcoming, so it should be released very, very soon. The evaluation criteria for the initial proposal are all available on our website. So if you actually go into our application guidance webpage, you'll find that we have quite a lot of guidance about the application, but we do also have all the evaluation criteria that we use for our peer review, so you can take a look through there. Thank you, Cherie, for sharing the link for Horizon. Yes, UK-based applicants can lead for EU Horizon calls. As we've mentioned before, GACD has a Find a Collaborator call tool. So if you are investigators in low and middle income countries and you'd like to try and find partners in Australia, please do post that tool. That's the best we can offer at the moment. The UK is also eligible as a partner within the EU Horizon call. If you were from a government organisation from South Africa, you would need an Australian partner to apply through the joint call, or an EU Horizon associated partner to apply through Horizon. So I like this one actually. We've developed a new intervention and want to test the effectiveness as part of a Type 1 hybrid implementation research application. So if it's never been tested anywhere, then that's unlikely to actually fit in the remit of call. But if it has already been tested somewhere, and even if the evidence is something like a case study, then you can make the case for that being good evidence to try this out. And a small pilot is going to be at least a reasonable start to that. So if USA is partnering with Vietnam, then you would, I'm afraid, be having to look at the NIH. So again, that is just a hold your horses, keep waiting, keep watching. It's a really volatile situation, and again, it's changing every day. Would it be preferable to focus on one NCD or NCD as a whole? It doesn't really matter. You can focus on an NCD, on multiple NCDs, or on prevention or NCD risk factors. It's really what your expertise is in. So we're looking for strategies to strengthen health systems to tackle NCDs rather than just NCDs. So if you're thinking about that, it is things like, can we prevent people from developing type 2 diabetes? How do we strengthen the health system to do that? Something along those lines. But you could also be thinking about, can we help the health system to manage people with multiple NCDs? It's everything within that remit. So it's just health system focused, NCDs and their risk factors. So in summary, LMIC needs to have a partner in Australia to apply for the joint process, yes. And LMICs that want to apply for Horizon need to apply with a Horizon associated country, but they can theoretically apply straight to NIH, but we don't at the moment know when or if the NIH will be able to release that call. Dear, There is no link to register for the webinar, Horizon webinar. It's a live stream. And if you actually scroll down to the bottom of that page, you'll find that it's got a thing saying it will be live streamed here. So you just need to set yourself a reminder. I'm sorry, it's not quite as useful as you would imagine. US investigators could apply with Australian partners. So we have had investigators from the US on applications funded through NH&MRC before, but obviously not as the lead investigator. They'd be part of the team. A nationwide project on vitamin D deficiency. I think Morven's answered that very nicely, because it would be it would be questioning what is the actual research question? What are we actually looking for here? Obesity would fall in remit for this call, absolutely, because knowing it is actually considered to be a chronic condition in its own right, but it's also a massive risk factor for so many other NCDs. So absolutely. Yeah, so you could, so I like this one as well. So can we apply to Horizon and Australia if eligible? You could apply for different projects. So what you can't do is apply for the same project to the joint process and to the Horizon call. But if you were working, let's say if you're a lead on a Swiss project and you're applying through Horizon, and then you're a co-investigator on a different project with an Australian lead, absolutely, you could also apply as a co-investigator through that call. And then there's interest, is there interest in this call for studies involving rehabilitation strategies for chronic musculoskeletal conditions in primary healthcare? Absolutely. Musculoskeletal conditions are absolutely within remit. They're NCDs, many of them. So yes. So if you're applying for funding in Brazil, if you're eligible to apply for PESHB, so you're in one of the institutions in Sao Paulo state, then you can just apply straight for PESHB. If you're based somewhere else in Brazil and don't have any partners that can apply for PESHB, then yes, you would need to apply with a principal investigator from Australia. And thank you, Anna, that was great. We've already done Heather. Dental is interesting. Again, I think dental would come under prevention. So you need to argue very carefully whether a dental, some kind of prevention of dental caries is going to lead to prevention of other NCDs further, or of NCDs further down the line. Hybrid type 2 implementation and effectiveness studies do fall within the scope of the GACD call. Thanks, Izzy. Do you know what? We've just made it to the bottom of the list of questions. I think
there's two I picked up that I'm not sure were answered directly or indirectly. So I just say for a joint call, do both applicants apply through their respective funding agencies? And that came from Carmen a little while ago. I'm not sure if that got answered already.
No, not. I'm sure it wasn't. Thank you. So for the joint call, you submit one application and we will share it with the respective funding agencies.
And there was one more as well. I might post it actually because it's a little long. But it says if we have PIs from multiple countries with funding agencies in South Africa, Brazil, Australia, and others, can each of the PIs make an application? And the projects would be overlapping. There's a central project and several sub-projects that could come out of it, but the specifics would be determined by the main project, which starts early next year.
Yeah. Okay, so that's interesting. I think the issue you're facing there is that you need to make sure that those sub-projects are completely separate from that central project. And also there's quite a significant element of risk in there that you might get one project funded and not others. So those, I think, are all the things that you need to consider. So actually what I would suggest is that you sit down as a team and work out a sensible strategy and what you would actually prioritize, rather than trying to maybe spread yourselves too thinly across such a wide range. how would you select the lead applicant for Australia? You would need to reach out through your networks or through our Find a Collaborator tool, and then hopefully find somebody who is interested in collaborating with the right appropriate expertise and keen to help. I did answer the ICNR one. We've done that. So yeah, we are absolutely at the end of the list of questions. Izzy, I haven't missed any more, have I?
Not with the list I've been keeping.
You are a star. Thank you. So I guess what I would like to do is I'm just going to briefly leave you with just a couple of thoughts and say thank you all so very much for actually joining us. And just think about these kind of key considerations for this call. Remember that the focus is implementation research. Think about your stakeholder engagement. Think about a strategy for measuring implementation research outcomes and real-world effectiveness outcomes. Remember to balance the workloads and partnerships within your consortium. Think about embedding capacity strengthening, and remember that sustainability is absolutely key. I'm really grateful for you all for joining us. I'd like to say a massive thank you to the excellent GACD team. So that's Izzy, Cherie, and Morven, who've been helping me with this. I'd like to say an absolutely massive thank you also to Anna and Marsha for joining us from Peshby today and helping to answer some of your questions. Do keep an eye on the website, and we will put up any future links, particularly for the Peshby webinar, which I think should be excellent. And thank you all for joining us. Have a lovely evening, morning, rest of your day. Thank you and goodbye.